my colleague, Leslie Love. She deserves all of our applause, our thanks, and our love as a champion for justice in this legislature. Thank you, Leslie, for being here.
First of all, can you hear me? Check one. First, I'd like to thank the Honorable Representative Yusuf Rabi. He deserves all that praise and clapping. And then to all the nurses, a shout out to you. You deserve the honor and the praise. To all the caregivers, you deserve the honor and the praise. So I don't have, I'm not going to keep you long either. And I don't have statistics to share with you or a list. What I have is my life experience. From back when I was in college, over 30 years ago, and I didn't have health care. You know, they didn't have a plan where I can go under my parents' health care. And I remember going to Planned Parenthood for my female services and medicines. And then I remember when I got my first job and the difference between having a PPO insurance or HMO insurance, and now I have Blue Cross insurance and everybody wants to see me. This is not an argument against insurance, but this is a fight for our lives. Single-payer insurance makes sure it doesn't matter if you have a pre-existing condition or you just found out, whether or not it's a virus or it's a death sentence, whether or not it's cancer or a cold, you are taken care of equally across the board. It shouldn't matter if you get injured in a car or if you get injured at your home. Your health care should take care of you. And we need to do a better job of that in the United States. And we can definitely do a better job of that right here in the state of Michigan. And so I will stand with you, Yusuf Rabi, to make sure that we have health care for the young, the born, to when you're older. As a person who is a caregiver of my 81-year-old mother, who worked hard all her life, earned a pension and retired with health care, but for some reason, she now has no health care. Well, she does have health care, but her health care from her job doesn't matter. We had to get rid of all of her possessions. And so now we're down to Medicaid and Medicare covering her expenses. When she has a fistula and they're talking about whether or not it's worth the procedure because, you know, she's got really bad health care, do we really want to do that and use that money? Absolutely. Because this is a fight for our lives. Health care matters. And we all need to have health care to be healthy individuals. And you notice when, just my last thing, you notice when you go to a grocery store and you see that hand sanitizer? Even grocery stores kind of get it on some level. That they understand that, you know, there are viruses, there are things that, you know, there's lots of contagion. Southeastern Michigan has the highest rate of hepatitis we've seen in a long time. And so maybe even the grocery stores are saying, hey, here's a little hand sanitizer. Well, I say that's one small step. What we have to do for all the people of this country, of this state, is look out after all of them and make sure they have this health care, and a health care that is affordable, and a health care that is quality. So we'll continue to fight for this, because it is not just a fight against something, but it is a fight for our lives.